If you're over 60, these 3 hand symptoms could mean you're having a stroke right now, and most people ignore them, thinking it's just arthritis or getting older. As a healthcare professional who's worked with stroke patients for over 2 decades, I've seen too many seniors miss these warning signs until it's too late. Just last week, a 74-year-old patient came to me saying her coffee cup felt heavier in one hand. She thought it was her arthritis acting up. It wasn't. She was having a stroke. Type 1 in the comments if you've ever noticed sudden weakness in just one hand that you brushed off as normal aging. Here's what terrifies me most. Strokes don't always come with the dramatic symptoms you see in movies. No sudden collapse, no slurred speech, no facial drooping. Sometimes it's just your hand that stops working properly. And by the time you realize what's happening, critical brain tissue has already died. If you're watching this channel, you know I'm committed to giving seniors the honest health information that could save your life. Every day, 2,000 seniors experience a stroke in the United States. That's 1 every 43 seconds. You probably think stroke symptoms are obvious, the face drooping, the slurred speech we all know about. But here's what most people don't realize. 25% of strokes start with symptoms so subtle, they're dismissed as normal aging. I've seen 82-year-old patients who couldn't button their shirts anymore, 67-year-old grandmothers who suddenly couldn't write their grandchildren's names, and 75-year-old men who lost their grip strength overnight. They all thought it was just getting older. Today, I'll share 3 hand symptoms that could save your life, help you recognize them instantly, and show you exactly what to do in those critical first minutes when brain tissue is dying. Symptom 1. Sudden one-sided hand weakness. Let me start with sudden one-sided hand weakness. And I know what you might be thinking. Hand weakness might remind you of arthritis flare-ups or muscle strain. But here's the thing. This neurological emergency is actually one of the most dangerous warning signs available to older adults. Now, you know what I see all the time? People come into my office saying, "Doctor, my hand just doesn't feel right today." And honestly, I get it. We're used to aches and pains as we age, right? But when I ask them to describe exactly what happened, that's when the alarm bells start going off in my head. Here's what makes sudden hand weakness so critical. And this is where the science gets really fascinating. When you experience true stroke-related weakness, you're literally losing the connection between your brain and hand muscles within minutes. We're talking about real-time brain damage happening right now. 85% of stroke survivors will experience some form of upper limb impairment, and it starts with this exact symptom you might be feeling. Let me break this down for you in simple terms. Sudden hand weakness involves something called motor cortex disruption. Think of it as the electrical system in your house suddenly losing power to one room. Your motor cortex is like the key that starts your muscle movement engine. As we get older, our brain becomes more vulnerable to these blood flow interruptions. You know what I mean? And when that specialized hand knob area of your brain, yes, that's actually what neurologists call it. When that area loses oxygen, your hand loses strength immediately. Here's what really concerns me about my older patients, and maybe you can relate to this. So many people tell me, "Oh, doctor, I just thought it was my arthritis acting up again," or "I figured I slept funny on my arm." But stroke-related weakness? It's completely different. It's sudden, like a light switch being flipped off. It's one-sided, affecting just your left or right hand, not both. And it's a complete loss of strength. Not just the discomfort we associate with joint problems. All right, I want everyone watching to do this test with me right now. Seriously, pause the video if you need to. Hold both arms straight out in front of you for 10 seconds. Go ahead, I'll wait. If one arm drifts downward, or you can't maintain that position, this could be stroke-related weakness happening right now, and you need to call 911 immediately. Comment below with a 2. If you just did that test, I want to know you're taking this seriously. Unlike arthritis, which typically affects both hands gradually over months or years, stroke weakness happens suddenly and affects only one side within minutes to hours. Here's the scary truth that keeps me up at night. This weakness can start so subtly that you almost miss it. Maybe your morning coffee cup feels heavier in one hand, not both hands, just one. Or You can't grip the steering wheel as tightly on one side. One patient told me she couldn't turn her house key with her right hand, but her left hand worked fine. She waited 3 days thinking it would get better. 3 days. By then, what started as subtle weakness had progressed, and unfortunately, some of that brain tissue was permanently damaged. But here's what gives me hope, and why I'm making this video. If you recognize these signs within that critical 3 to 4.5 hour window, modern stroke treatments can literally stop brain damage in its tracks. We can restore blood flow, save brain tissue, and preserve your independence. But only if you don't wait. Only if you call 911 the moment you notice that your hand isn't working the same way on both sides. Symptom 2. Sudden hand numbness. Now, let's talk about our second neurological champion. And this one might genuinely surprise you. It's sudden hand numbness, or as we neurologists call it, acute sensory deficit. And here's the thing. You might think of hand numbness as just circulation problems, right? Maybe you slept on your arm funny, or you've been gardening too long. But listen to me carefully. This symptom is actually one of the most recognizable stroke warning signs you can identify. Let me share something that absolutely blew my mind when I first learned it in medical school. Here's what's remarkable about stroke-related numbness. Just one affected hand contains warning signals for 93% of stroke cases, according to CDC statistics. Think about that for a second. 93%. That makes it one of the most reliable predictors of any stroke symptoms we have. For older adults who might already have existing numbness from diabetes, and I know many of you do, this incredible diagnostic specificity is absolutely invaluable. But here's where stroke numbness gets really fascinating, and honestly, a little terrifying. During the acute phase of a stroke, something devastating happens in real time. Blood flow to your sensory cortex, that's your brain's feeling center, completely stops. It's like someone just cut the phone lines between your hand and your brain. Your ability to feel temperature, texture, pressure, even pain gets broken down into smaller, disconnected signals that just disappear. Imagine your hand's sensory system like the touch screen on your phone. When it's working, every touch registers perfectly, right? But during a stroke, it's almost like your brain's sensory system has been unplugged entirely, making it impossible for your hand to communicate with your brain. The connection just goes dead. Now, stroke numbness isn't just about losing feeling, and this is crucial for you to understand. This symptom is also a direct brain damage indicator. Complete loss of sensation provides immediate evidence that brain cells are literally dying right now. That complete sensory loss represents about 85% of what doctors need to diagnose a stroke emergency and get you life-saving treatment immediately. I know what some of you are thinking right now, but doctor, I already have diabetic neuropathy. My hands are numb half the time anyway. How would I possibly know the difference? And that's such a smart question, because 26.8% of seniors deal with diabetes-related numbness. Here's the thing about stroke numbness that makes it completely different, and I want you to remember this. Because stroke numbness is so sudden and complete, you absolutely can tell the difference. Diabetic numbness? It creeps up on you gradually, over months, even years. It usually affects both hands somewhat equally, and it feels like wearing thick gloves all the time. But stroke numbness? It happens in minutes, affects just one hand, and feels completely different, like that hand has been literally disconnected from your body. One patient described it perfectly. Doctor, it felt like my right hand wasn't even mine anymore. Try this test right now. Gently pinch the skin on the back of both hands with your other hand. Can you feel the pinch equally on both sides? If one hand feels completely numb or dramatically different from the other, and this happens suddenly within the last few hours, you need to call 911 immediately. Comment with a 3 if you just did that test, and let me know what you felt. This simple assessment could literally save your life. Symptom 3. Loss of fine motor control. Our third warning sign is sudden loss of fine motor control. And honestly, this one breaks my heart because it's often the most devastating for my patients' daily independence. This symptom has a very special characteristic that makes it unique among all stroke symptoms, and I need you to pay close attention here. Fine motor loss affects something called the corticospinal tract. Think of it as the superhighway between your brain and hand muscles. Now, this might sound like it's just everyday clumsiness, right? We all drop things sometimes. But here's what's fascinating. Stroke-related fine motor loss actually gives us some incredible diagnostic advantages that can save your life. Let me explain what's happening in your brain. When you lose most fine motor skills gradually, say from arthritis, you're mainly losing complex coordination over months, which affects daily activities slowly. But stroke-related motor loss? It contains a significant amount of immediate dysfunction. An immediate dysfunction is literally the fastest developing stroke symptom you can recognize. Your brain can lose fine motor control and start showing coordination problems within 15 minutes of stroke onset. 15 minutes. The research on fine motor loss absolutely stunned me when I first read it. In one groundbreaking study, participants who experienced sudden fine motor loss didn't just lose hand dexterity, they lost everything. Their ability to write their own name, button their clothes, even handle their medications safely. But here's the part that really got my attention. The seniors in this study showed especially dramatic decline in independence over just 6 hours without treatment. 6 hours from functional to dependent. You know what makes this so different from the other symptoms we've talked about? Fine motor loss is amazingly revealing for stroke diagnosis. Unlike weakness, which can have a gradual progression and might fool you, fine motor loss is immediate and complete. It happens with such sudden onset that emergency room doctors use it as a primary diagnostic tool. Alright, here's the test that could literally save your life. And I want everyone to do this with me right now. Hold up both hands. Try to touch each fingertip to your thumb, one at a time, as fast as you can. Start with your index finger, then middle, ring, pinky. Do it on both hands simultaneously. Can you do it smoothly and quickly on both sides? If you suddenly can't do this smoothly on one hand, and I mean this happened recently, not something you've struggled with for months, or if you can't pick up a coin from a flat surface, or you can't button your shirt when you could yesterday, this could be stroke affecting your motor cortex right this very moment. Comment 4 if you just tried that finger test and tell me, was there any difference between your hands? And here's another quick check. Try to write your name with both hands. I know, your non-dominant hand won't be perfect, but can you at least form recognizable letters? If your dominant hand suddenly can't write legibly when it could this morning, that's a medical emergency. One of my patients, Martha, called me panicking because she couldn't thread a needle for her quilting. Doctor, she said, I've been quilting for 40 years, and suddenly my fingers won't cooperate. Thank goodness she didn't wait. We got her to the hospital within 2 hours, and she recovered completely. But if she had waited until the next day, thinking it would improve. While the research clearly shows that recognizing hand symptoms alone can help identify stroke, combining symptom recognition with the right kind of immediate action creates what emergency medicine calls a life-saving response. The results become greater than what you'd get from either symptom awareness or emergency response by themselves. When you recognize these hand symptoms and then call 911 within the critical window, your stroke treatment responds much more strongly than delayed recognition alone. In fact, this combination can restore what researchers call functional independence even in people over 75 years old. But only if you act within the first 3 to 4 and 5 hours. Now, I know some of you are sitting there thinking, but doctor, I have diabetes and my hands are already numb half the time. How could I possibly tell the difference? And that's such an important question because 26.8% of seniors deal with diabetic neuropathy. Here's what you need to know. Stroke numbness feels completely different from diabetic neuropathy. Diabetic numbness is like wearing thick winter gloves that never come off, right? It creeps up gradually over months or years, usually affects both hands somewhat equally, and you can still feel pressure and movement, just not as clearly. But stroke numbness? It's sudden, happening within minutes to hours. It's complete, like that hand has been completely disconnected from your nervous system. And it usually affects your entire hand at once on just one side, not the gradual stocking and glove pattern of diabetic nerve damage. One patient told me, "Doctor, it felt like my right hand belonged to someone else." For those of you carefully watching your blood pressure, and I know many of you are, I actually have some reassuring news. Recognizing these stroke symptoms early, actually helps your blood pressure management in the long run. Why? Because quick stroke treatment can prevent those dangerous blood pressure spikes that happen when strokes go untreated. Your cardiovascular system will thank you for acting fast. Now, if you take blood thinners like warfarin, Eliquis, or Xarelto, you might be thinking, won't that complicate my treatment? Here's what's crucial. Yes, it's absolutely important to tell the paramedics and emergency room staff immediately about your blood thinners. But please, don't let medication concerns delay calling 911. Modern stroke treatments are sophisticated. They can work safely, even with anticoagulation therapy. The key is getting to the hospital quickly so doctors have options. And for anyone dealing with arthritis, I see those knowing nods. Stroke weakness is completely different from arthritis flares. Arthritis pain comes and goes with weather changes, activity levels, and inflammation cycles. It typically affects both hands, develops gradually over time, and involves joint pain, stiffness, and swelling. Stroke weakness, it's sudden onset, like someone flipped a switch. It's one-sided, affecting just your left or right hand, not both. And here's the key difference. It doesn't involve joint pain at all. It's pure weakness without the aching, swelling, or stiffness you associate with arthritis. If your hand suddenly stops working but doesn't hurt, that's actually more concerning for stroke than if it's painful. All right, let me give you clear, specific action steps that you can take today, and I mean today, not tomorrow, not next week. These steps could literally save your life or the life of someone you love. First, do the hand strength test right now while I'm talking. Hold both arms straight out in front of you for 10 seconds. I'll count with you. 1, 2, 3. Are both arms staying level? If one drifts down, that's a problem. Write down what you noticed. Second, practice the fine motor test I showed you. Touch each fingertip to your thumb on both hands, index, middle, ring, pinky, and notice any differences in speed or coordination. This should become as automatic as checking your blood pressure. Do this every morning when you take your medications. Third, create your stroke response plan right now. Pull out your phone, yes, right now, and program 911 into your emergency contacts if it's not already there. Then write down your current medications, dosages, and your doctor's name on a piece of paper. Keep this by your phone, in your wallet, and give a copy to your emergency contact. Fourth, and this is crucial, teach one family member or close friend these 3 symptoms we've discussed today. Show them the arm test, the finger test, explain the numbness signs. Make sure they understand that if you show any of these signs, they need to call 911 immediately, not drive you to the hospital themselves. Fifth, take out your calendar right now and mark a date 90 days from today. Write stroke risk assessment with doctor. This is when you'll sit down with your physician to reassess your stroke risk factors and discuss personalized prevention strategies based on your health history. Here's your timeline for awareness. After 2 weeks of doing these daily checks, you'll start paying attention to subtle changes in your hand function that you might have missed before. After 30 days, you'll notice you're more confident recognizing concerning symptoms and differentiating them from normal age-related changes. After 90 days, you should have a complete stroke prevention and response plan in place, including updated risk factor management. The question now isn't whether this information is helpful. You already know it could save your life. The question is whether you'll take that first step. Will you do the hand strength test before you go to bed tonight? Will you program 911 into your emergency contacts before you close this video? Will you commit to 90 days of daily stroke awareness to protect your brain and preserve your independence? Because here's the truth. I can give you all the medical knowledge in the world, but it only saves lives when you act on it. Your brain, your independence, your ability to hug your grandchildren and write them letters, it all depends on what you do in the next few minutes with this information. Comment below with 5 if you're committing to this 90-day stroke awareness plan. I want to know you're taking this seriously, because someone you love is counting on you to recognize these signs when they matter most.